Hello YouTube, this is Carrie, and we are now down to 24 hours and counting until I'll be going into the surgery center for sex reassignment surgery, or genital reconstructive surgery, whatever you want to call it, GRS or SRS. I had my consultation several days ago, pretty much the day after we arrived in Thailand, but I hadn't had a chance to talk about my consultation yet, and while I'm talking about my consultation, where, it's when I actually went to Dr. Chettawut's office and met the surgical team and had my pre-op exams, I also wanted to talk about why I picked Dr. Chettawut out of all the SRS surgeons in the world for me. So basically, the primary reason why I picked Dr. Chettawut is, for me, from the very beginning, it was down to two surgeons, because there are two general techniques of sex reassignment surgery that are performed in the world. One of those, which is the most common, which is performed pretty much everywhere by every surgeon, is, and what is most commonly cited, is the penile inversion technique. Basically, what that means is that during the surgery, basically, they take the skin off of the outside of the penis, turn it inside out, and that becomes the vagina. And then there is a special technique, non-penile inversion, which is only done by a few surgeons in the world. And those surgeons are Dr. Suporn, Dr. Chettawut, and I think that the PAI Institute by Dr. Preacha does something like a hybrid technique. Now, I've also heard rumors that Marcy Bowers has started doing kind of a hybrid. There's a couple of American surgeons who are doing the hybrid technique now, where it's part inversion, part skin graft. But that was the primary motivator, was that Dr. Chettawut and Dr. Suporn do an analogous non-inversion technique, or analogous, I don't know. But pretty much there was no decision for me on that. I had to have that particular technique from the very beginning, because basically what analogous means is, if you look at an actual development chart of the parts of the body that eventually during fetal development become the penis and the clitoris and the labia and the scrotum and all the other gender differentiated parts, they are made from exactly the same body parts. We as human beings start out life in a gender non-differentiated form, and with genitals that are exactly the same regardless of what gender that baby will eventually become. So for example, there is the genital tubercle, which can become the penis or the clitoris depending upon whether there are certain levels of certain hormones present. And it's because these things are exactly the same organ and differentiate based on hormones rather than chromosomes why intersex conditions exist. I've been meaning to make a video on sexual differentiation for a long time, but as it pertains to this video, basically what the analogous non-inversion technique does is that it creates the structures of the vulva out of the exact same material that became the male parts. Basically, the glans becomes the tip of the clitoris. In the penile skin shaft leading down to the scrotal tissue, that becomes the inner labia, and the inside of the labia, which again is analogous, that part in a cisgender female is made of the same material that, when exposed to testosterone, differentiates into a penis. And the outer labia is made of the scrotal skin, and then the vagina is made of a skin graft. And now, in a cisgender woman, the vagina is made from a different thing that, there are two undifferentiated internal genital structures in the fetus. There is, I think it's the Mullerian ducts and something else. I can't remember. And that is actually what the vagina and the cervix and the uterus and all those things are made out of, wherein somebody who will be exposed to testosterone and differentiate more towards the male pathway, those things close up and the male internal structures are what develops. So there is no analogous structure to the vagina that still exists in somebody who was exposed to enough DHT, testosterone, to have their body differentiate to what is generally considered male assigned at birth. But the external structures in the analogous non-inversion technique, everything is made of the material that it would have been made of had you been born a cisgender woman and not exposed to the testosterone and DHT that caused your genitals to differentiate to the male genitals. Therefore, everything after the surgery will feel exactly like it would have felt if you had been born a cisgender woman. And this is a big thing for me because I experience phantom sensations in the downstairs area. Every single time, something makes me consciously aware of the anatomy that I presently have. It's almost like there's mentally a set of genitals below my actual set of genitals. Like externally I'll be feeling that there is a penis and a scrotum there, but my brain is then sending me these weird phantom sensations that wants to be able to feel a clitoris and a labia and a vagina. And so, and it's like I can feel what those parts would have been made of. I can feel what it would feel like to run your hand across that area and what it should feel like. So to me, I absolutely believe that there was no option except the analogous technique, because then it will feel, hypothetically, exactly like my phantom sensations have always said it should feel, because everything is made of the exact same material that it would have been. And so therefore the exact material that my brain is programmed to expect. Where I have heard people who have had the penile inversion technique say that when they have intimacy, things feel a little bit shifted around and it takes some getting used to. So to me, this technique was what I had my heart set on since the very beginning. So for me, the choice from the very beginning was pretty much either soup horn or Chettawut. So basically, I compared results from the two surgeons. Now, there used to be a database of SRS results on Ann Lawrence's website. This database, unfortunately, does not exist anymore. But on that database, it had pictures from hundreds and hundreds of SRS results from every single surgeon. And looking at the actual anatomy, and I got to study and see which surgeon had the results that most matched what I was expecting to look like and what I wanted to look like. And from those pictures, Dr. Chettawut's were always the ones that to me looked the best out of the surgeons that I was considering. The results from Dr. Broussard also looked very good. He does this special technique that uses the urethra to create some sort of internal structure between the inner labia that makes it look more of that deep red flushed color that cisgender women have inside. So that is a very unique technique as well. But my friend Zoe went to Dr. Broussard and she lost a ton of sensation and almost bled to death. And Dr. Broussard does his surgeries in 2 hours. He does 4 a day. So I was kind of off put by that and decided, nah, not for me. Dr. Chettawut only does 1 surgery per day. So, I feel like that means that his focus is going to be on that 1 surgery. And there's less of a chance of kind of the assembly line factory thing going on, but that's just me. See, this is another thing, is that everybody believes that their SRS surgeon is the best. So really, whichever one you pick, make it for personal reasons, because if you know what you want and you do your research and you pick one based on what you are personally looking for, the odds are you're going to be very satisfied. So I have my reasons for picking Dr. Chettawut. A lot of people have their reasons for picking Dr. Broussard or Dr. Bowers or Dr. Suporn or Dr. Precha, whatever. It all depends on personal preference and what you want. So Dr. Suporn is also very well known for producing good quality, consistent visual results. And Dr. Chettawut and Dr. Suporn are both very famous for, probably out of everybody in the world, preserving the most nerves. Because again, because of the analogous technique that they use, less things are moved around. And because of that, they are able to preserve more nerves and more sensation. Both of them are practically legendary in terms of the sensation that they're able to preserve. So that was another big consideration of mine, is that, again, is that almost always their patients retain orgasmic ability and retain sensation. And, well, I don't want to be completely asexual afterwards. I actually want to be able to enjoy my surgery and my post-op body. So, and again, it varies from person to person, but again, Broussard, who a lot of people told me I should look into, a lot of people lost sensation from him, so again, that scared me. Basically, the one thing that really got, my friend Ariana also went to Dr. Suporn, and she's pretty much over the moon with her results there. People are like, the people that I've known that have seen it have said that it is a beautiful result, and Dr. Suporn and Dr. Chettawut both have a very good reputation with aesthetics in terms of how it looks. They've had their patients go to gynecologists and they couldn't tell the difference. So that's another thing for me. One thing that Dr. Suporn is kind of like, every surgeon has things that they're good at and that they're bad at. And, if you look at various surgeons, there's usually some sort of complication that's common with them. In the case of Dr. Broussard, again, sensation is often an issue. People report, the surgery is kind of violent as it's happening, and blood loss and sensation loss are common, but the aesthetic results are amazing. So, with Dr. Suporn, the common thing that happens the most often is leaving too much erectile tissue. Basically, he retains a lot of erectile tissue because he's trying to recreate what in cisgender women is known as the bulb of the clitoris, which is this erectile tissue that is internal. And so there are a lot of people, especially those who are more well-endowed, who afterwards have reported discomfort because it feels like they're still getting internal erections. And that was immediately my decider that I was not going to Suporn, because probably erections are my single biggest source of dysphoria and personal distress. And so I really do not want that experience of erections afterwards. And Dr. Chettawut tends to remove more erectile tissue, which, that means the sensation isn't quite as good, the function isn't quite as good. Again, Suporn, function and sensation are his number one things, in addition to how it looks. He is generally considered one of the best surgeons in the world. Probably the top 5 are usually Broussard, Bowers, Meltzer, Suporn, and I forget who the 5th one was. And Dr. Chettawut would be like 7th or 8th on that list, and generally what people talk about. So the fact that Dr. Chettawut removes more erectile tissue and yet still does the same analogous non-inversion technique as Dr. Suporn, plus as a bonus he costs $5,000 less. Dr. Suporn has like a 1-year, Dr. Suporn is like the grade A #1 surgeon in Thailand who everyone wants to go to. So he has over a year waiting list, and he costs over $15,000. Dr. Chettawut is the 2nd most expensive surgeon in Thailand, but he still only costs $9,500, plus you're probably going to need an extra $1,000 for the skin graft, which everyone needs. Which, yes, I did, because I'm rather small down there. But, where was my train of thought? So yeah, that was a bonus for me. And also he has a much shorter waiting list. His waiting list is only 3 to 4 months. So like, and this is an issue with Dr. Bowers in America too, her waiting list is like 2 years long. Like, all the American surgeons have waiting lists that are over a year long, so it can be a bit taxing to wait that long, especially if you have very strong genital dysphoria. So that was the big thing for me too, was cost and time. With Dr. Chettawut, I could get SRS this summer. With Dr. Siporn or Dr. Broussard, I would have to wait probably another 6 months to a year for results that probably weren't going to be that much better. And honestly, I was kind of leaning towards Dr. Chettawut since the very beginning, because again, when I looked at his results to see what I personally felt like this is what I should look like, to me, Dr. Chettawut's matched that the closest. So, you know, the rest was just kind of bonus, and so that is why I picked Dr. Chettawut. Now, in terms of the consultation, I did have that a couple days ago, so I'd like to talk about what happens during the consultation. Basically, I'm having 2 surgery procedures done. I'm having genital reconstructive surgery, and I am also having a trachea shave, which is going to shave down my protrusion there. Now, here's the thing. A lot of people told me, you're getting a trachea shave? What? I didn't even notice that you had one. But this is something that, like, I constantly feel it, and I constantly see it, and it constantly bothers me. So, you know, I was like kind of debating this in my head. It's like nobody's seeing, like, everybody's telling me they barely notice it. And so, you know, am I just crazy here? Am I just seeing things that I feel like this makes my neck and my chin area look more masculine? Like, am I just stressing out about nothing? In the consultation, Dr. Chettawut will be very honest about, you know, what you can expect based on what you have to work with. So during the consultation, he actually confirmed that he thinks that I really do have a rather large trachea. It's just kind of buried under fat, but when he actually felt the lump, it is very pronounced. And so that is what I feel on a constant basis, and it's one of the things that causes me anxiety, because being able to feel that my throat sticks out like that, to me, feels very male. It makes me feel male in the same way as certain downstairs anatomy sticking out makes me feel male. So this is my thought going into this, is that those are the 2 parts of my body that to my own judgment feel male as I'm walking around and make me feel nervous about how my body feels. My face, while it does not look completely feminine, and I am possibly still going to get facial feminization surgery in the future, does feel female. Because the skin is still soft, and, you know, I can, you know, long hair to me feels feminine, and my mouth and skin texture and all that feels feminine. It doesn't necessarily look feminine, but it feels right. These 2 parts of my body do not feel right. They still feel like male features on a body that otherwise feels female. So that is what this is about, is that I am correcting both of the parts of my body that to me feel male. So after this, I will officially be in a body that to me feels female in every single way. You know, again, I might still correct certain parts that look more masculine, because I do want to not have to worry about my appearance as well. But I do think that it will be a big emotional boost to me to be living in a body for the first time in my life that really does feel female completely to my own judgment. In any case, during the consultation, they will take a picture of whatever surgical site you're having done. You need to present in paper your therapist letters with the original handwritten signature, and it has to be handwritten. It can't be a photocopy. You also have to present the results of your lab tests, and you have to settle any outstanding fees. And I had done my research in advance, so I knew, like, I double checked with Miss Som K, who does all of the emails and all of the and all of the setup. She speaks amazing English, so she is going to be like the one that you ask most of the questions. And so I took every chance that I had to ask questions beforehand to make absolute sure my letters were going to be accepted. Like, whenever I had any confusion, I made sure that I asked to double check, just to make sure that there was no possible chance that I was going to get rejected after I had come here. So I double checked my therapist letters with her beforehand. I double checked my lab tests. I double checked everything to make sure that it was acceptable. So when I got to the clinic, basically all I did was present her with my letters and present her with the chest x-ray that I had done, as well as the medical tests. And then, you know, she had a nurse review them to make sure that everything was all right. And then after that, they weighed me, and then I got to go up to meet Dr. Chettawut. And Dr. Chettawut is a very soft-spoken, humble kind of guy. He's very honest with what you can and cannot expect. Like I said, he told me in advance that my throat cartilage is very pronounced, so there's only going to be so much that he can do with that. He's going to do, you know, he showed me where the incision site is going to be, and he said we are going to remove as much as we can, but again, it is large, so there's a chance that it might not be a lot. This is also the only chance that you have to ask whatever questions you have. So one of the concerns that I had about a trachea shave was that some people had said that it's possible to lose vocal strength or have voice changes as a result of a trachea shave because the trachea supports the vocal cords. So there have been some cases of people having a trachea shave and they lose vocal quality afterwards, which obviously would be an issue for me. And so I asked him, I said, what are the chances that my voice will be affected? And he said that he makes extra sure that he does not take off too much to cause vocal changes. He has never had that be a problem, so I appreciated that. And then also I got to make my own special requests in regards to sex reassignment surgery. Basically, he will show you a diagram of where the vagina is going to go with your internal anatomy, and you know, he'll talk about the depth that you can expect and do a physical exam to see how much stretch the scrotal skin has, how big everything is, and how much material he has to work with, whether he needs to do the skin graft, things of that sort. And then you have a chance to make requests and ask questions and talk about what your concerns are. In my case, the most important thing to me is appearance, just because I want everything to look as much like a cisgender female vulva as possible. I really care about the definition of the inner labia, and I really care about the clitoral hood, and I care about all of those like little intricate bits. I really just want to look at my own body, and to my own judgment, it is a female body. And so I told him that. And again, he was honest with me. He said, you are pretty small down there and your scrotal skin does not have a lot of stretch to it, so that is going to limit how much we can do with that. But again, but then he reassured me that everything, you know, there is, and you know, he did say that I needed the skin graft because again, I'm small. Also, one of the things that Dr. Chettawut sometimes has issues with is the clitoris being a little bit big. I've heard this from my friend Julia. Sometimes it looks a bit like a reduced, like it looks obviously like a small chunk of the penis rather than a clitoris. So me personally, I actually said to him, since I've always been a bit small down there, is there any chance that I could have a smaller looking clitoris to match the relative size of my genitals that I've always had? And he said absolutely, he can do that. And I also said that depth isn't a huge issue for me. Right now I'm dating a trans guy, and honestly, like, I'm not too worried about penetration. Like, people stress out about the depth that they get, you know, they're like, well, I want 6 or 7 inches so that I can accommodate a big guy or something, where honestly, like, most cisgender women's vaginas are only like 5 inches, even stretched. It's very common for people who are very well endowed to hit the cervix. So, I mean, in my humble opinion, that's kind of overrated, and that's not something that I'm worried about. Again, that's just me. Again, during all these videos, I don't want to rag on anyone who has different expectations or wants different things. This is completely just me and what I've always wanted my own body to be like and what's a concern to me. So I told him that, again, if he needs to sacrifice a little bit of depth to make the outside look and feel more cisnormative, I am totally okay with that, because those are my primary concerns. So yeah, and then, you know, he asked me if I had any other questions. In my case, when I took my blood tests in America, my white blood cell count was a bit high, so they were worried that I might have an infection. They had me do a repeat CBC test and a urinalysis when I got there to make absolute sure that I didn't have a bladder infection or urinary tract infection, which the tests were negative, so I didn't. I don't know why my white blood cell count was high, but everything's in the clear. And then he gave me this giant packet of information. I'm gonna get that actually. And then he gave me this giant packet of information, which is basically the Vagina Operator's Manual. It includes a paper on how to deal with the post-op surgical dressing, how to empty the catheter bag, and also this is the protocol for what it's going to be while I'm in the surgery center and when I'm discharged back to the hotel. There are an entire 2 pages on dilation. This is the schedule. Dr. Chettawut says 2 years for 2 hours a day. Not looking forward to that, but it's one of the things that you just have to do. And then this was the pre-op instructions, including what I had to do for the bowel cleansing regimen, which I'm currently in the middle of. I took a laxative and did an enema last night. That second one hurt like hell. Ugh. And then he also gave me Swift solution, laxatives, and a lot of Gatorade mix so that I don't get dehydrated while I'm pooping my guts out. And then basically, you know, he told me when I need to take all of those things, what time I need to be downstairs and ready for surgery. That is tomorrow afternoon at 1 o'clock, I have to be downstairs. I have to stop all food and water as of 7 a.m. tomorrow morning because it's imperative that my stomach is empty going into surgery. And then again, basically they just spent a long time running over the pre-op care and the post-op care to make sure that everything goes smoothly. And then I got back to the hotel and once I started doing the bowel prep, and now I'm just waiting for tomorrow when the driver will come pick me back up and it will be time to roll. So that's basically what the consultation was like and why I chose Dr. Chettawut and the instructions, and now we're just playing the waiting game tomorrow. All right, I'll see everybody then. This is going to be an adventure. Fun. And, you know, I continue to get more and more excited the closer we get. It's like, now that I'm only 1 day away, it's like, it's kind of like the reality is coming over me. And again, all of the reasons why I'm doing it are coming back into my head, and I'm so looking forward to it, you know. Not the aftercare, which is going to be a pain in the butt, inevitably and literally. But in a few months, when everything's healed and I can just go about my life and not worry about all those things that I talked about before, it's going to be great. So I have full confidence in Dr. Chettawut and his surgical staff, and I've been on Susan's transgender forums and seen many, many people go through Dr. Chettawut. He's probably, out of that site, the one that the most people go to. Even though, again, for the trans community at large, Dr. Suporn is more of a popular surgeon, but seeing those great accounts over and over and over again of consistent results, not a lot of pain, the nurses being super attentive and people being over the moon with their results was was the ultimate deal breaker for me, in addition to all of the research that I did. So I have every confidence in the world that this is going to be great. All right, see you guys later.